Welcome all for the recall and revise series. So today we will cover a very important module, embryology module, and recalls from the embryology section. So Dr. Sansi, please read the question and attempt the answers.
Yes. During embryological developmental teaching, a trainee is asked about the origin of the allantois. The allantois is derived from which of the following structures? Ectoderm, endoderm, mesoderm, neural crest, intermediate mesoderm. Sir, option B, endoderm.
Allantois, very frequently asked concept. The allantois develops as an endodermal diverticulum from the yolk sac extending into the connecting stalk. Important derivatives are the urachus, median umbilical ligament after the birth, and persistence of the urachus may lead to the urachal cyst, urachal fistula. Next question, doctor.
Yes, sir. During a renal embryology discussion, a trainee is asked about the embryological origin of the ureteric bud. Okay, the ureteric bud arises from which of the following structure? Mesonephric duct, metanephric blastema, paramesonephric duct, cloaca, pepronephric duct. Sir, option A, mesonephric duct.
Yes, it is a mesonephric duct. The ureteric bud develops as an outgrowth from the mesonephric duct. The structures formed by the ureteric bud are ureter, renal pelvis, major and minor calyces, and collecting ducts. So the metanephric blastema forms the nephrons, Bowman's capsule, and the proximal and distal tubules. Next, doctor.
During gonadal embryology teaching, a registrar asked about the embryological origin of the ovary. The ovary develops from which of the following embryological structures? Neural crest, intermediate mesoderm, surface ectoderm, endoderm, somites. Sir, option B, intermediate mesoderm.
So the correct answer is a intermediate mesoderm. Gonads develop from the genital ridge derived from the intermediate mesoderm. Intermediate mesoderm leads to the gonadal ridge. Primordial germ cells migrate from the yolk sac. So absence of SRY gene leads to the ovarian differentiation. Next.
A newborn baby is diagnosed with cleft palate during neonatal examination. Okay, cleft palate. Cleft palate most commonly results from failure of fusion of which of the following structure? First pharyngeal arch, second pharyngeal arch, third pharyngeal arch, fourth pharyngeal arch, or sixth pharyngeal arch?
Cleft palate.
First pharyngeal arch, sir.
Yes.
Muscles of mastications.
Yes, first pharyngeal arch. Very frequently asked these pharyngeal arches. Okay. So cleft palate most commonly results from failure of fusion of the parietal shells, which are derived from the maxillary prominences of the first pharyngeal arch. Okay. The first pharyngeal arch gives rise to maxillary process, mandibular process. Palatal shells arise from the maxillary prominences. Okay. So development of the palate, primary palate origin is from intermaxillary segment. The secondary palate, it is the palatal shelves from first arch. Okay. So cleft palate, failure of the palatal shelf fusion. Cleft lip is the failure of the fusion of the maxillary process with the medial nasal process, and palate develops between 6th to 12th week. Okay. So why other options are incorrect? Second pharyngeal arch will give rise to muscles of facial expression. Okay. Third pharyngeal arch, stylopharyngeus. Fourth pharyngeal arch, laryngeal cartilages and pharyngeal muscles. Sixth pharyngeal arch, intrinsic laryngeal muscles. Okay. Next.
During embryology teaching, our trainee is asked about the derivative of the second pharyngeal arch. Which of the following combinations correctly represents derivative of second pharyngeal arch? The seventh nerve is present, muscle of facial expression is present, trapezius and styloid is present, A, B, 1, 2, and 3 is present. Sir, option B.
So the second pharyngeal arch is associated with the facial nerve and can give rise to muscles of facial expression, stapedius, stylohyoid, posterior belly of digastric, stapes, styloid process, and lesser horn of hyoid. Okay. So most of the structures from the S. Okay, S, second, and most of the structures from the S. Then important there is nerves, facial nerve. 7 now. Okay, cranial now. Muscles, facial expression muscles, and skeletal structures, stapes, styloid process. Okay. So structures not derived from the second arch. Muscles of mastication come from first arch, and stylopharyngeus is coming from the third arch. Okay. So from examination point of view, for nerve of the first arch is a fifth nerve, that is the muscles of mastication. Second arch, the nerve is a seventh nerve, that is the facial expression muscles. Then third arch is a ninth nerve, cranial nerve, stylopharyngeus muscle. Okay. And fourth and sixth is a 10th cranial nerve, laryngeal muscle. Next.
A pregnant woman with mechanical heart valve receives warfarin during the first trimester. The fetus is subsequently diagnosed with features suggestive of warfarin embryopathy. A mechanical heart valve receives during warfarin. What is the commonest feature of warfarin embryopathy? Cleft palate, limb reduction, defects, nasal hypoplasia, spina bifida, microophthalmia. Sir, option C, nasal hypoplasia.
Yes, this also very frequently asked. The characteristic and most commonly tested feature of warfarin embryopathy is the nasal hypoplasia, depressed nasal bridge or saddle nose. Other classical features are stippled epiphysis, chondrodysplasia punctata, limb hypoplasia, growth restriction, eye abnormalities, CNS abnormalities. Important embryological point: risk is greatest exposure during 6 to 12 weeks of gestation. That is also SBA. Then warfarin, classical fetal abnormality, nasal hypoplasia, stippled epiphysis, valproate, neural tube defect, isotretinoin, craniofacial abnormalities, AC inhibitors, renal degenesis, lithium, Epstein anomaly. Okay. Why other options are incorrect? Cleft palate, not a classical or commonest feature. Limb reduction defects, more typical of thalidomide. Spina bifida associated with valproate. Microophthalmia may occur, but not a common feature. Next.
During fetal embryology teaching, a trainee is asked about the timing of pituitary gland development. The anterior pituitary adenohypophysis begins to develop at approximately which weeks of gestation? Second week, fourth week, sixth week, 10th week, 16th week. Sir, option B, fourth week.
Yeah, it is a fourth week. The anterior pituitary adenohypophysis begins developing around fourth week of gestation from an ectodermal outpouching of the primitive oral cavity known as Rathke's pouch. Anterior pituitary oral ectoderm, that is the Rathke's pouch, is the embryological origin. Posterior pituitary, it is the neuroectoderm from the diencephalon. Okay. So developmental process, Rathke's pouch grows upward from the stomodium, and neuropharyngeal diverticulum grows downward from the forebrain. Then fusion forms the pituitary gland. So structure and their origin: adenohypophysis, surface ectoderm; neurohypophysis, neuroectoderm; Rathke's pouch, primitive oral cavity ectoderm. Okay. So why other options are incorrect? Second week is the embryonic disc formation stage. Sixth week is the later developmental maturation. 10th week is the pituitary is already formed by 10th week, and 16th week endocrine functions maturation stage. Next.
During a basic science viva, trainee is asked about the largest cell in the human body. Which of the following is the largest cell in the human body? Oocyte cell. Option C, ovum.
Yes, ovum is the largest cell. The ovum is the largest cell in the human body, diameter of approximately 100 to 120 micrometer, visible to the naked eye, contains abundant cytoplasm, organelles required for early embryonic development. Ovum is the largest human cell, sperm is the smallest human cell, neuron is the longest cell, skeletal muscle fiber, largest multinucleated cell. Okay, so neuron, longest cell, not largest diameter. Then hepatocyte, metabolically active liver cell. Skeletal muscle cell, large multinucleated fiber, but not the largest single reproductive cell. Megakaryocyte, large marrow cell producing platelets. Next.
A pregnant woman is inadvertently exposed to warfarin during early pregnancy. The fetus subsequently develops features of warfarin embryopathy. Most commonly occurs following exposure during which period of gestation? Before 4 weeks, 6 to 12 weeks, 14 to 18 weeks, 20 to 24 weeks, third trimester only. Sir, option B, 6 to 12 weeks.
Yes, 6 to 12 weeks. Warfarin embryopathy classically occurs with the first trimester exposure, especially between 6 to 12 weeks of gestation during organogenesis. Next.
During fetal sexual differentiation, Müllerian inhibiting substance is produced by which cells of the fetal testis? Leydig cells, Sertoli cells, spermatogonia, Germ cells, interstitial cells. Sir, anti-Müllerian hormone is released by Sertoli cells.
Yes, answer is a Sertoli cell. So Sertoli cells produce Müllerian inhibiting substance MIS or AMH, causes regression of the Müllerian ducts in the male fetus. Leydig cells produce testosterone. Next.
The trigone of the urinary bladder is derived from which embryological structure? Paramesonephric duct, cloaca, mesonephric duct, allantois, urogenital sinus, endoderm. Sir, mesonephric duct. Option C.
Yes, mesonephric, very frequently asked question. The trigone of the bladder develops from incorporation of the caudal mesonephric ducts into the posterior bladder wall. Next.
Yes, sir. During human reproduction, the secondary oocyte completes the second meiotic division at which stage? Before ovulation, during fetal life, at puberty, at fertilization, during implantation. Sir, option D, at fertilization.
Second, the oocyte. So it is at fertilization. The primary oocyte arrest in the prophase 1 during the fetal life. Secondary oocyte arrest in the metaphase 2. Completion of meiosis 2 occurs only after fertilization. Next.
Which of the following structure is derived from primordial germ cells? Sertoli cells, Leydig cells, oogonia, granulosa cells, Zika cells. Primordial germ cells, oogonia. Sir, option C.
Yes. So primordial germ cells migrate from the yolk sac and give rise to oogonia in females and spermatogonia in males. Next.
The greater omentum is derived from which embryological structure? Ventral mesogastrium, dorsal mesogastrium, septum transversum, midgut mesentery, cloacal membrane. Sir, option B, dorsal mesogastrium.
It is dorsal mesogastrium B. Okay, so the dorsal mesogastrium gives rise to greater omentum, gastrosplenic ligament, and splenorenal or linosplenic renal ligament. Next.
The skeletal muscles of the body, except some craniofacial muscles, are primarily derived from which of the germ layer? Ectoderm, endoderm, mesoderm, neural crest, surface ectoderm. Sir, option C, mesoderm.
Skeletal muscles of the body are derived from mesoderm. Most skeletal muscles arise from paraxial mesoderm, somites. Next.
The embryonic structure formed from the inner cell mass, where gastrulation later occurs. Okay, is trophoblast, syncytial trophoblast, trilamina germ disc, chorion connecting stalk. Sir, trophoblast. No.
Embryonic structures form from the inner cell mass where the gastrulation occurs. So gastrulation is a trilaminar disc formation. So before that is a bilaminar germ disc formation. So the inner cell mass forms a embryoblast which develops into the bilaminar germ disc, epiblast and hypoblast, and gastrulation later occurs through the epiblast. Okay, next.
Yes. During laparoscopy, a small cystic remnant is noted near the fallopian tube, representing a remnant of the upper mesonephric duct. Which of the structure is this? Gardner cyst, urachus, hypoapophoron, parahypoapophoron, corpus luteum.
Near the fallopian tube. It is epiphoron. The epiphoron is a mesonephric duct remnant located in the mesosalpinx near the ovary and the tube. Okay.
Okay.
Next.
During embryological development, primordial germ cells migrate to the developing gonads and later forms the oocytes. The oocyte is ultimately derived from cells originating in which of the following structure? Neural crest, intermediate mesoderm, yolk sac, surface ectoderm, allantois. Sir, option C, yolk sac.
Yes, it is a yolk sac. So primordial germ cells originate from the wall of the yolk sac near the allantois during early embryonic development. These cells subsequently migrate to the genital ridge, differentiate into oogonia in females, eventually form primary oocytes. So primordial germ cells, oogonia and spermatogonia. Then site of origin is a yolk sac, and gonadal ridge origin is an intermediate mesoderm. So although mature oocytes develop within the ovary, their precursor primordial germ cells originate or initially arise from the yolk sac.
During renal embryology teaching, a trainee is asked about the origin of the ureteric bud. Okay, the ureteric bud develops from which of the following? Metanephric blastoma, mesonephric duct, paramesonephric duct, cloaca, allantois. Sir, option B, mesonephric duct.
Yes, it is a repeat question. The ureteric bud arises as an outgrowth from the mesonephric or the Wolffian duct. It forms the ureter, renal pelvis, calyces, and the collecting ducts. Next.
The lower one-third of the vagina develops from which of the following embryological structure? Mesonephric duct, paramesonephric duct, Müllerian tubercle, urogenital sinus, or the cloacal membrane. Sir, option D, urogenital sinus.
So urogenital sinus, the vagina has got a dual embryological origin. Upper two-third is from paramesonephric ducts and lower one-third is from urogenital sinus. Next.
During early embryonic development, gastrulation is an important developmental event. Okay, gastrulation involves which of the following processes? Formation of trophoblasts, formation of bilaminar disc, formation of 3 germ layers, implantation into endometrium, neural tube closure. So option C, formation of 3 germ layers.
Yes. So formation of 3 germ layers or the gastrulation converts the bilaminar embryonic disc into a trilaminar disc consisting of ectoderm, mesoderm, and endoderm. This occurs through a primitive strip. Okay.
Yes. Erythritula reaction is classically seen in which of the following tissues? Cervical epithelium, myometrium, endometrium, fallopian tube, ovaries. In placenta, endometrium, sir, option C.
Yes, it happens in the endometrium. Erythritula reaction refers to the hypersecretory or typical changes in the endometrium associated with pregnancy, ectopic pregnancy, and gestational trophoblastic disease. Next.
At approximately 4 weeks of embryonic development, primordial germ cells are present in which of the following structures? Primordials are present in which of the structure? Genital ridge, neural crest, yolk sac, mesonephros, primitive streaks. Sir, option C, yolk sac. Repeated
Yes.
question.
Yes, the question is repeated. It is a yolk sac. Primordial germ cells originate near the wall of the yolk sac, close to the allantois before migrating to the developing gonads. Next.
Yes. The external genitalia remains morphologically undifferentiated until approximately which weeks of gestation? Sir, option B, C, 6 weeks.
I think it is 8 weeks. It's
6 to 8.
before 8 weeks. Yeah. Male and female external genitalia appear similar. Differentiation begins thereafter under the hormonal influence, testosterone and dihydrotestosterone. External genitalia become clearly distinguishable by around 12 weeks.
Okay. The following image shows an ICSI, intracytoplasmic sperm injection. Okay. Procedure being performed during assisted reproduction. The arrow indicates a small structure located within the perivitelline space adjacent to the oocyte, which is the structure indicated by the arrow. So can I see the photo? Okay. Okay. Option. Zona pellucida, corona radiata, first polar body, protonucleus, cumulus, oophorus. Sir, option A, zona pellucida.
They are talking about this. The answer is given here. It is the first polar body.
Okay.
Okay. So here only in examination you will have to find out. Okay. So here it was a first polar body. The arrow should be there exactly towards the first polar body. The first polar body is a small haploid cell produced following the completion of the first meiotic division of the primary oocyte. It is typically seen within the perivitelline space between the oocyte membrane and the zona pellucida. Identification of the first polar body helps embryologists assess the oocyte maturity, orient the oocyte during the sperm injection, and avoid damage to the meiotic spindle. First polar body indicates metaphase 2 oocyte. Zona pellucida is a glycoprotein outer covering. Pronucleus appears after fertilization, and corona radiata, that is the granulosa cells surrounding the oocyte. Why other options are incorrect? Zona pellucida, that is the outer glycoprotein shell around the oocyte. Corona radiata is the outer granulosa cells. Pronucleus visible after the fertilization. Cumulus oophoricus, cluster of granulosa cells surrounding the oocyte. Okay. So that finishes the few questions from the embryology. Thank you.